Hi there. Permit me to introduce myself. I'm Robert V. Carita, Senior MD, Fellow of the American College of Cardiology with special competence in adult echocardiography, as well as a diplomate of the American Board of Clinical Lipidology and Medical Director of Cardiovascular Risk Reduction, USA. Many of you are not aware, but there is approaching a crisis of medical care in the United States. Over the last 40 years, we have become heavily dependent upon surgical and interventional procedures for the treatment of cardiovascular disorders. Over the next 10 years and beyond, the funding of these procedures will be extremely curtailed by insurance companies, including Medicare, which are now and will in the future be shifting much of the medical costs back to the patient who are denied these services. These changes are already being implemented by Medicare starting in January of this coming year, 2013. They will soon be followed by the commercial insurance companies. For those of you in your 40s and 50s, Medicare, as previously known, will not be the same and may not even be there. The only future avenue that an individual can maintain affordable present-day longevity without expensive interventional procedures is to start proactive preventive cardiovascular care as early as possible in the 85% of our population who are destined to suffer from this disease. This concept of heart disease prevention is Cardiovascular Risk Reduction USA's brand and represents tomorrow's cardiology. Do not mistake proactive care for today's usual standard or secondary medical cardiovascular disease prevention therapy. Proactive care is far beyond, starts well before, and has a superior biochemical approach to present-day usual standard medical therapy. Proactive preventive care, appropriately applied years before, prevents atherosclerosis from being initiated. If perchance proactive care is delayed, hazardous vulnerable plaque, which is the cause for heart attacks and most cardiovascular events, can be stabilized or eradicated. If treatment is successfully accomplished for at least 1 year and maintained for a lifetime, new events are almost unheard of. I invite you to become engaged in proactive cardiovascular prevention. If you ignore this concept, or if you fail to inform your children, who will be more greatly impacted by these future changes, you may be doing them a greater disservice than yourself. My website homepage possesses a very informative movie slideshow with an audio and a PDF presentation without audio but possessing informative links. These presentations were originally prepared by me for my former alumni, but in all fairness should be available to any receptive individuals. Proactive prevention of cardiovascular disease is the only alternative to maintaining inexpensive present longevity in the face of our coming medical financial crisis. Become engaged with tomorrow's cardiology, proactive cardiovascular preventive care. Feel free to browse this very revolutionary website.